Good afternoon. Thank you so much for taking time out of your Sunday to join us. My name is Athena McKay. I'm the Executive Director of Flint Innovative Solutions, and we ask you to share this with your networks through Facebook and through YouTube to get everyone on board so that they can get more information on how to better themselves, their family, and their overall health. We have this session recorded. We welcome all of your questions through our Facebook and YouTube chat. If you've missed a session, you can always go back to Flint Innovative Solutions YouTube or Facebook channels. We are holding these podcasts on the second and fourth Sundays throughout the month. This production is brought to you by a grant funded by the Community Foundation of Greater Flint. The NNICE funding mechanism is a national network to innovate for COVID and adult vaccine equity. We wrote a grant, we being Flint Innovative Solutions, called Genesee County COVID-19 Portal, or GCCP, where we work with local faith-based organizations, community centers, and to increase access to vaccines and totaling shots of 23 shots in the arms with the help of Michigan United, which you'll hear some folks soon, our great panelists, also the Genesee County Health Department. For Innovative Solutions is also developing a mobile app to bring all of these pieces, such as vaccine clinics, testing sites, and community resources into one mobile app as a centralized place. I want to introduce our panel, our longstanding panel of great, intellectual, beautiful women who will share with you their passion, also about men's health, and will continue about COVID and mental health. In this order, Dr. Latressa Gordon will introduce herself, Nurse Battle, and Nurse T. Later on in the program, we have a special guest for you, Dr. Don Vereen. And I'm not going to get into all of his credentials right now because you'll be blown away. But I ask you to go ahead and share this out with your networks. And I will bring on Dr. Latressa to share a little bit about her passions on why we need to take it to the streets.
Hello, good afternoon, everyone. I'm Dr. Latressa Gordon, registered nurse with Michigan United, the Genesee County Health Department, and also Ascension Genesis. My passion began when COVID-19 came out in 2019. I want to use my gifts and talents. Everything was going haywire, crazy in our community, lack of resources, lack of equity for resources. In 2019, we did not have the vaccine, but there were lack of testing sites, lack of ways to get information on how to get into the ER or to your PCP. So that's where my passion began. And also losing several close family members. I didn't want anyone else to have to experience that. So that lit a fire under me, and I'm out here in these streets because I want to bridge that gap. The health department and Michigan United became instrumental. Once this ideal came to fruition, they birthed it. When we said, well, we'll go out there, they provide us with all the necessary equipment, the tools. Once we get out there, they provide us all the necessary staff so we can bring vaccine equity, health literacy within the community, which is so important because COVID-19 is constantly changing. The vaccines are constantly changing, the dates, the how many boosters you can have, and also there's upcoming new vaccines material. They'll be coming up in the forthcoming. So we're here to keep our community educated. We're part of the community, and we love doing what we do. We're just part. We take it to the street because we're from the street, as we say. We're from Michigan. But if you need any information from us, we're more than happy to provide that. But the biggest thing is health literacy. We want you to know what's going on, what COVID-19 is, what your health conditions in, how you can play a part in it, where you can go, and what you can do to decrease. We can't prevent it, but decrease the risk of you contacting COVID, decrease the risk of you being hospitalized through vaccinations, and other mitigation risks as far as hand washing and social distancing. That's what my passion. My passion is to help keep the city of Flint safe. And I'd like to pass it off to Tanya. Is it Nurse T? Nurse T.
Hi, everybody. Thanks again for joining. I am Carnisa Martin, otherwise known in the community as Nurse T. I have been a nurse for 21 years. I work at Hurley Medical Center as the patient resource and community advocate. I also work as a public health navigator, RN for Michigan United, and part-time for Genesee Health Department. So my passion begins with being out in the community and creating safe spaces for education. Um, a lot of times patients don't have a clear understanding and there's a lot of fears developed. We have 4 challenges in the community that I have identified while being out there. And the first one is there's a mistrust in healthcare systems. A lot of the community residents and the people that I grew up with, and then in the neighborhoods that I serve, as far as even patients that I took care of, and even some of my family members, they don't feel comfortable with healthcare systems. So there's a mistrust in healthcare systems. The second thing is, as Dr. Gordon mentioned, is about the health literacy. People don't know what they don't know. A lot of times we think we know one thing and then we get familiar with that, but we don't have the latest research or it's not evidence-based practice and it's not put in a way to where we can understand, articulate it, communicate it, and have full comprehension of it. So health literacy for me is huge. The other thing is the availability of resources. Not everybody has access. Everybody don't have access because they don't have knowledge, and they may not have transportation. They may not even know that different vaccine clinics are existing or where they can get education, and it's not access is being delivered to all 4 corners of Flint, which I call the north, the south, the east, and the west. And then a lot of it is stereotyping. A lot of stereotypes are in our community. Our community have a lot of stereotypes which have developed fears because of a lot of historical trauma. So why I'm very passionate is because I want to be able to connect with the community. I want to be able to serve the community that I grew up loving, that I grew up knowing. A lot of times, sometimes we get called at risk youth. I was that at-risk youth. So to be able to serve the community that I was known as an at-risk youth in, as far as teenage pregnancy, graduating high school with a 2.5 GPA and not even knowing that I was going to be able to become a nurse. But because I am a nurse and I have been a nurse for 21 years, caring for the city of Flint and surrounding areas, I'm very passionate in being the connectivity and building unity in the community so that we can bridge the gap so that our community feel comfortable, they feel well informed, and they're able to make wise decisions not based upon fear, but about from current information, shall I say. So I'm very passionate about that. And now I'll turn it over to Tanya.
Happy Sunday, everyone. And thank you for tuning in today. My name is Tanya Battle, and I'm a nurse also at Hurley Medical Center, and I am also a seasonal nurse at the Genesee County Health Department, as well as a nurse navigator with Michigan United. And Michigan United was very instrumental in bringing us together. We all share the same passion for Nurse T and Dr. G. We all share the same passion for getting the information out to our community, so that the community would have a better understanding of what was going on during COVID. And Michigan provided that avenue for us. And as I think Nurse T mentioned, this is our community, the community where we grew up. Our families are here, our children, are here. And so we wanted to be out in the community, helping the community understand what was going on, and giving them proper information, the correct information. There was a lot of misinformation, but giving them information to help them make good decisions, and to understand what was going on in the midst of COVID. So taking it to the street, we are out in the street, just providing that information and answering questions. And we want to hear what our community, we want to hear the issues of our community. So if we can provide any information, any resources, in helping people feel comfortable and feel safe, and like Nurse T said, again, just bridging the gap between the community and our healthcare system. So I am going to turn it back over to Miss Athena.
Thank you so much. As you can hear, the passion, the expertise, and the knowledge from these women have been out on the street, in the streets, sharing information, how to better your health, how to maintain our sanity, as we were talking about mental health last year, last session. May was Mental Health Awareness Month. We're going to continue that conversation a bit with our special guest. Also, Dr. Vereen is a psychiatrist. That's it. I had it right the first time. It's Sunday, I think. So my mental health is fatigued. So y'all pray for me. But I'm going to turn it back over to the ladies. They're going to share more information about some very interesting topics about COVID, of course, vaccine clinics, testing, some information about men's health, and something you may not have been aware of. Dr. Latressa is going to share about Medicaid expansion. So let me open the screen back up. You'll have a PowerPoint on the screen for more information. After these sessions, we're going to dive in with Dr. Vereen with more information.
Okay, we have facts and answering questions. Unwinding Medicaid continuous coverage. What is the connection between Medicaid coverage and the COVID-19 public health emergency, or PHE? When the pandemic began in early 2020, Congress enacted several laws to help people and states get through the public health and economic crisis. One law gave states additional federal funding, Medicaid funding, as long as they kept people enrolled in Medicaid coverage during the COVID-19 public health emergency. This policy, called the continuous coverage requirement, remains effective until PHE ends, public health emergency ends. Under the continuous coverage requirements, people remain eligible for Medicaid, even if they have changes in their income, family size that would have made them ineligible in the past for Medicaid. Under normal circumstances, unless you voluntarily disenroll, move out of state, or die, the policy has kept millions of people covered during the pandemic. It ensures they have access to health care services, including COVID testing, treatment, and vaccine. When will the PHE end? The PHE end date is uncertain. The Secretary of the United States, or Department of Health and Human Services, HHS, has the authority to declare a PHE, which has been renewed every 90 days during this pandemic. The federal government, has promised to keep each state aware at least 60 days before the notice of the PHE ends. The most recent extension for the PHE lasts until mid-July, which is coming up shortly. And the Secretary of State Secretary did not give a notice for mid-May that it would end. So it's expected to last until mid-October now. So see the table below. If the PHE ends on July 15th, 2022, if it's extended, it'll go until October 15th, 2022. The notice will be provided around August 16th, 2022. If it's extended on October 15th, 2022, it will end, the PHE will end on January 15th, 2023, and the notice will go out on November 16th, 2022. And like I said, it's very important because this is how we're getting our COVID testing, the treatment, and the vaccines, and people that would not normally be covered under Medicaid are being covered under the Public Health Emergency Act. Okay. There are a few guidelines that must be followed to complete the unwinding process. States must complete a full eligibility review using the enrollee's current information. States can't terminate enrollees' coverage based on information obtained during the PHE. States must try to determine a Medicaid enrollee's eligibility through electronic data sources such as wage data before mailing renewal forms. This process is called ex parte renewal. If the state can't determine an enrollee's eligibility during the electronic data source, then a renewal form will be mailed to the enrollee. Enrollees have at least 30 days to complete and return renewal forms to the state. People who don't complete and return the renewal form could lose their Medicaid coverage. States must provide written notice at least 10 days prior to terminating coverage. Some states allow enrollees to complete the renewal process online, including reporting changes, updating verification documents, but others require documents to be mailed. So be sure when you're sending in those which is required. What challenges could Medicaid enrollees face during this unwinding process? Millions of enrollees could lose their Medicaid coverage during the unwinding process for one or two reasons. Eligibility. They are no longer eligible for Medicaid because their circumstances change. Income has gone up. Household size has decreased or went down, and you're no longer pregnant, etc. Procedural. They lose their coverage because administrative errors, barriers they face during the renewal process, or other reasons not related to eligibility. This includes people who remain eligible for Medicaid as well as people who no longer are eligible for Medicaid but may qualify for coverage through the Marketplace Medicare or job-based coverage. Some examples of barriers enrollees may face: they don't receive notices or renewal forms because they moved during this pandemic time. So keep up on a current address or with the number. We'll have that in the chat room where you can contact. The renewal form they receive is confusing, or the written language they don't speak, and the steps they need to take are unclear. We'll have also information on, if you speak a different language, how you can contact someone to help you fill out this form so you can adequately fill out this form is very important. They have questions about the process but can't reach the Medicaid agency. Call center because the wait times are too long. For reasons others stemming from structural racism, Black and Latino enrollees are more likely to have experienced instability in employment and housing during the pandemic, which means they will have a greater risk of receiving renewal forms or losing their Medicaid coverage than white enrollees. So we want to make sure that this information is passed out, that you're aware of these time frames, and we'll put that information of where you can call and the website in the chat. Thank you. And I will pass it on now to Nurse Tanya.
And I am just going to give an update on some of our COVID-19 testing. No, I'm not. Yeah, the clinic information. I'm sorry. So because of our numbers had went down, but I think they're on the rise again. But the Genesee County Health Department did scale back on some of the testing locations as well as the vaccine clinics. So now we still have our standing clinics. However, they have gone to every other week. And so this coming up week, starting on the 14th, which is Tuesday, and on Thursday, we will be at Our Lady of Guadalupe on Tuesday from 12 to 4, as well as Shiloh Missionary Baptist Church on Thursday from 3 to 6 p.m., as well as Hasselbrink on Friday from 4 to 6 p.m. And then the next week will be Central Church of the Nazarene from 10 to 12. So every other week they're alternating on Monday and Thursday, and then on Wednesday of the next week. And I also want to talk a little bit about, well, it is Men's Month, and we are so excited to hear Dr. Don and his presentation. But while we were out in the community, we've done participating in several events, and June is Men's Health Month. So this was just perfect that we ran across this men's health checklist. And the checklist goes over checkups and screenings and testing that men should have starting in their 20s. It talks about, the testing that you should have, like your physical exam, how often you should be getting your physical exam, how often you should be getting your PSA blood levels, how often you should be getting all these tests and screenings, starting at what age, and every year or every 3 years. And it explains what everything is, why those screenings and testings are so important. So please be on the lookout for, we have lots of men's health events coming up this month. Again, it is Men's Health Month, to raise awareness about all of the issues that our men are facing. I'm so excited about this event. It's just called Men's Health Awareness, and it is sponsored by an organization called Meow, who is called, I think is this menopause or what? Well, little do we know, a lot of people didn't know that men also go through menopause. So that was yesterday. We were out at an event, and a young man, I think her name is Tasha, she had some information on that, and he was just blown away by the fact that men go through menopause, which is, it's hormonal changes as well. But this particular event is going to be held on Friday, June 24th, from 5 to 7 p.m. at Goggins Hall. And the address is 309 East Main Street. And it's actually in Flushing, Michigan. I think that zip is 48433. So again, if you get an opportunity to come out, and it's going to be lots of resources, lots and lots of just important information. And it's also going to be a very fun and a networking event as well. So please come out and join us. And I am going to turn it over to Nurse T.
Hi, everybody. Once again, thank you for joining. Once again, I know sometimes that can be redundant, but we do really appreciate your time and your commitment to come on a Sunday and join with us. I just want to give a couple additional dates for vaccinations. On June 13th, from 4 p.m. to 7 p.m. At Memorial Park Playground. We will be doing free vaccinations. The address is 1026 Church Street, Flint, Michigan, 48502. So that is going to be an amazing event for the community to come to. We also will have an ice cream social come in, which we will do vaccination. We will give the address and the time in the chat for that later. Juneteenth, June 17th, downtown in the Kersley flat lot, we will be doing vaccinations from 2 to 3, and that's a Friday. And then on Saturday, we'll be doing vaccinations again during the parade, after the parade, and when the festivities is going on at the flat lot, and that would be from about 12 to 5. Let me see, and then June 25th for Flint Pride, for 2 to 3. So we will make sure you guys are updated with all the information. Community testing sites, Word of Life Church, there's still a testing site Tuesdays and Thursdays from 12 p.m. to 6 p.m. 460 West Atherton Road, Flint, Michigan, 48503. You do not need an appointment. Bethel United Methodist, Wednesdays, 10 a.m. to 4, Thursdays, 1 to 7, 1309 North Ballinger Highway, Flint, Michigan, 48504. And then Macedonia Baptist Church, Mondays, Fridays, and Saturdays from 10 a.m. to 3, G5443 South Saginaw Street, Flint, Michigan, 48505. Even though our numbers are kind of in the double digits, the last I checked, for most hospitals, it's still important that if you're having any signs or symptoms that you get tested and you seek proper care. Let's see. Unique COVID tests for over-the-counter COVID tests are available for Genesee County residents in need. Can't find a test in the store, we can help. If you are a community-based organization with clients in need, contact Genesee CHAP to receive a bulk delivery of tests. Are you a resident, a school, or medical practice? If so, make a referral for CHAP to receive a free COVID-19 over-the-counter test delivered within 24 hours. And you can make a referral to Genesee CHAP. The number is 810-953-2427. Utilize the community referral platform, and you can even fax Genesee CHAP referral form. Or you can visit the website at ghc.org CHAP referrals. So, and the 3 questions I want to go over real quick. There may be a choice to make about your healthcare. Remember, you are always the one that's being empowered to activate your healthcare power. Make sure you get the answers to these 3 questions. What are my choices? What is good and bad about each choice? How do I get support to help me make a decision that is right for me? The goal is to make a decision that's right for you. Making a decision that's right for you also protects your family and the community.
Thank you so much, ladies. So I have a couple of follow-up questions. That was a lot of information. Y'all always come with so much good stuff. I'm like, okay, let me try to take some notes. Nurse T, let me start with you.
Okay.
You shared those 3 questions, right?
Mhm.
And you're out in the streets, you're at the health fairs and everywhere else in the community. Other than those 3 things, what are some questions that you hear from people when they question, what are some floating questions that we should put on the floor for the next part of our conversation?
Why is it important that I receive the vaccination? We hear that a lot. And then we also hear, because a lot of the community residents know that we're at a 61% vaccination rate, that they don't think that they should have to get the vaccination now, because a large percentage of the residents in the community have received the vaccination. So we hear a lot, well, everybody else got the vaccination, so now I shouldn't have to get the vaccination. But you do need to get the vaccination. And just educating. And then too, as far as the boosters, we keep hearing a lot of questions about the boosters and how many boosters are there going to be, and why do we got to keep getting the booster?
Thank you, ma'am. Dr. Latressa. So that was a lot on Medicaid. Thank you, Nursey.
Oh, you're welcome.
So PHE, if you could summarize it for us, and what do people need to do to stay enrolled? And then as it's unwinding, what are some of the questions? How can we continue to be advocates for health and keeping those benefits? You're muted, ma'am.
Hello, everyone. The biggest thing is right now we have the access to, like, we're vaccine equity, vaccine testing, and services through this PHE, the Public Emergency Act, or the CARES Act, which allows all these services that, like, say, you normally would not receive if you, like, say, wouldn't qualify for Medicaid under your eligibility, your income, or your housing size. But during the public health, this is a health emergency. COVID is a pandemic, a health emergency. So this kind of expands the criteria where you're able to enroll. So when this comes along and they scale that back or eliminate it, we're no longer in this emergency. These services that have been provided that should actually have helped people during this time that they really needed all along will start disappearing. Like the access, as you see now, you can kind of see in the community, like the testing sites are kind of decreasing, or the vaccine sites are kind of decreasing, but we're still popping up all over. We still have the testing, but as you see, the funding is going to start kind of scaling back because of the Public Health Emergency Act. But for Medicaid, you need to make sure your address is up to date. Your local address for the Medicaid agency, keep that, find that, contact them if you have any question. Go to healthcare.gov to contact them regarding the status, and keep up to date on your mail. And you might also be able to switch over to a healthcare that's less than maybe like low cost marketplace if you don't qualify for Medicaid anymore. So those are things that you want to be watchful for. Keep a lookout on your mail, or sometimes if someone calls, it's easy to kind of shuffle through your mail, or they say they don't question. Well, they say I don't qualify for. Well, I guess I don't qualify. Challenge it. Find out why don't I qualify. What do I need? What's my next step? Because I need these services. Because you might be in that gray gap where you can't qualify through an employer. You don't make enough. Your employer doesn't offer it, or you're just in that gray area where you don't qualify for Medicaid. But there's other services like Market Care or Marketplace through the government, healthcare.gov. And also, as one of those questions that we have out in the street, I had one personally, as for COVID, for being my healthcare provider. I went to see one that asked me, well, how did you get COVID and you're boosted?
Gotcha.
And we have everything. So this is just not in the streets. It goes all levels. And we have to explain that the variant that we have out here is changing. So it kind of escapes some of the vaccine, escapes some of your natural immunity, but it's still, the vaccine is still strong enough to kind of push it, hold up a fight to keep you out the hospital, decrease hospitalization. It's okay to go to the hospital if you need to, but it decreases your rate of being hospitalized or severely ill on a ventilator. So that's why I'm going to spill on one of those questions in the street.
Thank you. Nurse T, my question for you, and this may lead into Dr. Vereen's, is men have menopause? Like that's I was like, huh? Like I'm pushing that whole phase away from me, but do you want to elaborate a little bit?
I know that men do have menopause, and it started with the A. I'll have one of my colleagues help me out.
It's andropause.
It's andropause, yeah. So not everybody may experience it, but I know yesterday when she was educating, she was saying some men may experience it. And then just to see the young men reading the flyers, they were like hesitant and fearful. They was like, oh no, there's no way that we're going through menopause and our women are going through menopause as well. So we had to really explain to them that that's a hormonal change. And that's why it's so important for us to take care of our bodies. And the one thing about men's health, because I know the doctor is going to just give us a wealth of information, is just to kick it to them, is that the four concerns really with men is that they're hesitant. They're fearful to go to the physician. They don't do regular exams because they think because they got muscles and workouts sometimes that they got it all together. But it's beyond that. It's about the screening and the early detention. It's about finding out what's available for you to be successful in an event you do come, down with prostate cancer or colon cancer, because those are the leading risk factors that men have when they don't do their exams. I'm trying to say it lightly because sometimes men are just so, they're so touchy when it comes to that. And then also heart disease is a leading cause for men right now, and depression. And I also was reading about COVID, that a lot of men are having a lot of depression and long haul effects after receiving COVID that they don't normally deal with because they're private protectors and they don't like to share their, what's going on with them sometimes.
Thank you, Nurse T. Nurse Battle, did you want to share? I know you brought it to the table. Did you want to add anything?
I would just want to share a conversation that I had with a gentleman yesterday at the event we were at, and he said, I asked him, I was taking his blood pressure, and I just asked him straight out, and he was like, oh, he's like, he was just kind of a Debbie Downer. He had almost appeared to have lost hope. And I said, well, do you go to the doctor? How is your health? And he's like, he said his doctor retired and some woman took over.
And there you go, some woman.
Yeah, some woman took over. So, I just shared with him and just tried to encourage him. And I asked him, well, how come you don't go, other than the woman being the doctor now, how come you don't go to the doctor? And he said, what's the point? And then he said, he just doesn't want to know.
Mm-hmm.
whatever is going on, he said he just doesn't want to know. And that's the way that he deals with it. So, I gave my spiel, but I think it fell on deaf ears.
We got to keep trying, though. We got to keep planting the seeds. Thank you so much, lady. And Don, Dr. Vereen and I had conversations about some of these same topics. So, to no further ado, we're going to transition to bring Dr. Vereen in. Dr. Vereen, I'm not going to steal any of his thunder because it is wide and vast. His knowledge, his expertise, his experience in the health field. Dr. Don Vereen, if you could share a little bit about yourself and happy early Father's Day. I know we're a week early, but we wanted to give you your flowers. I know men like flowers too. So go ahead and unmute yourself, sir, and tell us a little bit about your educational background, why, and y'all out in Cyberland. This is my guy. What? Yeah, no, I'm supposed to point that way. This is my guy. He is the Don. He just his head size is holding so much information. It's amazing. Any conversation that we've had, he's been a wealth of information. Dr. Vereen, I'll turn it over to you to share your a little bit about yourself, sir.
Okay. It really is a pleasure to be here, and I'm happy to be here with my colleagues. This should be a fair amount of fun, even though we're talking about some very serious things. I will preface some of what I'm about to say with I am sometimes very direct. I find that you have to be that way, especially with men. I am a member of the Boy Club, and so I can speak from firsthand knowledge about some of the deficits that men have as compared to women. But let me go ahead and begin by saying I'm a public health psychiatrist. I have done clinical work. My area of expertise was in making evaluations in emergency rooms for people who had psychiatric as well as medical and surgical emergencies that can present as psychiatric problems. My career moved in an interesting direction in that I showed an interest in research, but found that a lot of research that is done at places like NIH doesn't quite focus on the kinds of things that we see as important. And the kinds of things that we're struggling with, they could benefit from having research. I am on the faculty of the Michigan Institute for Clinical and Health Research at the University of Michigan. And what we do there is we embed our research in communities like Flint, and we listen to the people of Flint, and the people of Flint tell us what the important health issues are. And men's health has come up on occasion, usually raised by women in the community as opposed to men, I must say. And we may do a research project that answers a question that hasn't been answered before. And often what we end up doing is translating what's already been done for our community. And then if it translates pretty well, but we need some more work done, then we do that extra work to fully answer the question so that we can have the best and most impact on our community. So a couple of things about men's health, and this is a mix of my opinion, both as a professional, but as a 64-year-old Black male, husband and father of two. The first thing that I want to say about men's health is that it is not just about things that are only male. There are lots of men, even lots of women, who, when they hear men's health, oh, it's only about penises, testicles, and things related to the male reproductive system. The same mistake is made for women's health. Women's health is not just about the female reproductive system. It's about everything female, everything female. So having said that, men in general, as you've heard from the previous presenters, men tend to appear late. They're late for lots of reasons. They're scared. There shouldn't be any shame in that. But in the culture we live in, men are supposed to be able to step up and not be afraid of anything. And they hide that by never admitting to what they're afraid of. To put that in a slightly different context, which is important for mental health and important for how we approach men. Men, first of all, I need to get this off my chest. It's an observation I've made since I was a little kid. And now that I have children, I have a girl and a boy, a young woman, a young man. Girls are smarter than boys. They always have been and always will be. Part of that smartness and part of that intelligence is women tend to have a better tolerance for feelings that are difficult to deal with. So when women are fearful, they may be fearful, but you see women perform more often than men when they're not feeling right about something. Part of that has to do with the fact that women often have children. And you may be fearful about something, but your priority is helping those children. And sometimes you're taking care of other loved ones, and your fears and other things take a back seat. They're secondary to the folks that you're caring about. Not that men don't care about things, it's just that they're evasive because it's hard to sit with the feelings. As a psychiatrist, I can tell you that when a man sits in a session with me, a woman sits in a session with me, there is much more give and take, asking the woman tough questions about what she's feeling, when she first felt them. The men would rather just leave them alone so that they can just keep doing what they're doing. The problem is, if you're having trouble peeing, if you're having other issues, you're having headaches, you're having chest tightness, the fear and the inability to deal with those negative feelings, to be able to even just sit with them for a few minutes to share with someone who could help them, that is detrimental. Teaching our men to be able to open up, relax a bit, and disclose. Some of that has to do with trust. We have all kinds of reasons to not trust people. But that issue of trust is paramount, and it costs us in terms of sickness, illness, suffering, and sometimes death. So it's an issue that we can work to get over. Men who are involved with other people, especially their wives, their girlfriends, their wives and girlfriends and female members of their families can be helpful in maybe even speaking for them sometimes, going with them. When no one's looking, holding their hand works very, very, very well. And I can share some personal experiences about that as well. And then the third thing that I want to say is that in the culture that we live in, when you're sick, that translates into your being weak. Men are about being men, being masculine, being out there, being upfront, being free to express themselves in the narrow way that they choose to express themselves, ourselves. This idea of weakness and not being male enough or macho enough, it runs across the races. And that's why I make the point that it's the culture that we live in that tells men that they can't appear weak. And they shouldn't be showing any sort of sickness. And so when you mention something like male menopause to a man, anything that suggests that they're less of a man, that's just, no, we are not going there. When in fact it's normal. And if I could jump right into some issues about male and female menopause, the term menopause basically refers to changes in hormonal levels, but more specifically, hormones that relate to procreation, hormones that relate to being able to continue on as a species, that you're able to have children and offspring. That's what the menopause is about, that the ability to be fertile is limited. Now, in women, the big difference and the reason why there's such a specific word, menopause, is because for women, that timing, there's a window of timing, a pretty narrow window of timing when the hormones change drastically and the ability to have children goes away. With men, the critical hormone, the critical hormones, but the critical hormone, testosterone, because there's just one in men. There are several in women, but one in men. And that one hormone gradually declines over time. So when there is a change, it's very difficult to see. And most men don't experience anything into their 90s. From what I'm remembering about research and definitions of male menopause, testosterone levels decline approximately 1% a year, starting at about age 40. So when you think about it, for the average male, a 20 or 30% decrease in testosterone levels may not translate into much. Certainly as men get older, they're doing less, they lose muscle mass, they're not as strong, they slow down. And the changes in those hormones, and that's reflected by the change in muscle mass, the change in activity, the slowing down, it's not associated with fertility as much. We know that men can father children well into their 70s and 80s. And if you're someone like Strom Thurmond, I believe he was over 90 when he was able, he fathered a child. So those are just some basic thoughts. And then I do want to make a point. I love the slide that Nurse Tanya had. The slide of men's health and when to get checkups and things like that. If you go back and look at that list, there's really only one thing or two things related to testosterone levels, I think, and libido, sex drive. those are really the only two things that don't overlap with women. So the list of the checkups and the things to worry about related to your heart and your lungs and the checkups and things like that, those are the same for women. So there's much more of an overlap than there is a difference. And that's why I started out my comments by saying that men's health and women's health are not just about reproductive issues in each group. It's bigger than that. Men don't go and get checkups for reasons different from women. But I will point out that men and women can experience an overlap of these diseases in the same way, in a different way, rather. So heart attacks in women, for example, may not show up, for example, as chest pain. It's not unusual for a woman maybe to experience some tightening in the chest, but she'll experience indigestion more often than men. She may even feel some pain in her jaw or a toothache. The same nerves that are struggling to keep the heart beating when it's being stressed are the same nerves that are involved in feeling pain in your jaw and in your teeth and in your neck, and your gastrointestinal system as well. And that's why they feel sick to their stomach, and then they try to treat their stomach and they put things off, and before you know it, the heart attack has blossomed, and they find themselves in the hospital late because they didn't recognize that they were having a heart attack. So those are the kinds of things that I think are important in men's and women's health. There are differences, but there's actually a lot more overlap. And the areas where there is a difference, the same thing is happening. Those hormones are changing. The ability to have children is changing. It's abrupt in women and not as abrupt in men. And that understanding can help in terms of approaching people. So anyway, I've said a bunch of things and I've tried to do it very quickly so that we can have more of an exchange, questions and answers, and most importantly, actually comments. Because people are very thoughtful. They know what they know. They're open to what they need to learn about. And your impressions and your thoughts and what you're already thinking is just as important as any questions. And if that's appropriate, I'll stop at this point and take any questions and any comments.
Thank you, Dr. Vereen. I'll start with the first question. As you can tell, audience, Dr. Vereen is very knowledgeable. He kind of skipped over the question I originally asked in his humbleness.
You can ask it.
Yes. Don, could you share some of the opportunities you've had to serve in the medical field?
Okay. Perhaps the best way to answer the question is really to give an honest recounting of how I got interested in medicine, and then some of the choices that I made, and then the opportunities that presented themselves to me. I had always wanted to be a doc. I was born in Biloxi, Mississippi in 1958 in the segregated South. I did not have any physicians in the family. But by the time I was 3 or 4, I knew what a doctor was. And somehow I decided that that's what I wanted to do. And it never went away. I went to, I majored in biology and psychology, so I've always had an interest in behavior, how people think. I've been interested in the effect of culture on how people think. Most importantly, my family grew up in the segregated South. Their ideas were colored by that existence. But when they left and they were freer to be who they were, their attitudes about things changed. And I'm a product of the changes in those attitudes. I went to medical school, had some wonderful teachers, very few of them African American. But in the medical profession, if it's done right, you get taken in, you get supported, because the assumption is once you get into medical school, you'll make a very good doctor, and they're invested in making sure that you get very good training. But I did have some Black teachers who were very influential, and they're near and dear to my heart to this day. They're colleagues, and a couple are actually friends. I got interested in medical school in issues that didn't show up in the medical books. So I was interested in things like gun violence in the 1980s, when people were not thinking about gun violence and weren't even putting the word gun in the same sentence with public health. I left medical school, went to a school of public health, where I met one person, a Black physician, who was seeing the same things I was seeing in the emergency room. She was a few years ahead of me. And we bonded and are still friends to this day. She is the dean of the medical school at the Charles Drew Medical School in Los Angeles now. And I got encouragement from people to do research in these areas that people didn't realize were important health issues. And I started on a research career out of that interest. But truth be told, I have to share this. I was also choosing to move in an academic position because I'd met a wonderful woman. She's an economist, actually a pretty world-renowned economist, a Black woman. And I figured if we were going to be able to stay together, I had to have a schedule that was as flexible as hers, especially if we had kids. And if I did academic work, I'd have more freedom than I would if I had to be in a clinic and a hospital, 8 to 6 every day, including weekends and taking call. And so I moved into this research direction. I hung on to those unanswerable questions, and I took that to the federal government and ended up focusing on drug abuse and addiction. You talk about an area where there's a lot of knowledge, but it's not used. There's a lot of prejudice and there's a lot of stigma. If you think there's stigma in mental illness and in mental health, and we know that there is, it's even worse with drug abuse and addiction. And in that time, I ended up teaching people who were members of the House, members of the Senate, presidents of the United States. And I ended up working for 2 presidents, advising them on how to think about drug abuse and addiction. It wasn't just about law enforcement, although law enforcement is helpful and it is important. It's perhaps not as important as treatment and prevention. And I was able to articulate things. I was able to help get research studies going, to provide the evidence for the kinds of prevention things that work and the kinds of treatment things that work. And I'll just mention one thing. We noticed that the approach for drug abuse and addiction, for treatment of drug abuse and addiction, was almost exclusively designed for men. That when you put women in these treatment modalities, women didn't do very well. And then we talked to these women and we talked to the treatment folks and discovered that you have to approach women very differently. And here are all the reasons why. And I'm very proud of the fact that the standard of care for men and women in some ways has to be different. And the standard of care, even at a place here like Michigan, you have to make those you have to take those kinds of things into account. And so after working at the White House, I set my sights even broader and realized that there's a lot of research out there that isn't making it to the public. In fact, there's a lot of research out there that isn't making it to our doctors, our nurses, our social workers, our community health workers. That research is not being translated. And so I've been devoted the last almost 20 years of my career in this translation of research to the public. And that's why my work with Athena McKay is focused on community-based work and then work that gets translated back to the doctors and the people taking care of folks and the people themselves. I find that social workers, nurses have a much better clue about what's needed, but still there's translation that's important. And I'm very proud to say that in my days at NIH, and then my days when I was at the White House, insisting that social work, insisting that nursing was at the table when we were making policy. And again, more information and better perspectives on how to deal with different types of patients, male versus female, for example. They were the voices that were much more in touch and could see much more clearly what the issues were and how to implement what we did know. And so long-winded answer to the opportunities. I've had many. I've appreciated the fact that I have had many. I'm blessed by the fact that I have had many and that I continue to do this kind of work.
Thank you so much, Dr. Vereen. I didn't want that to be left out of the conversation. And so, Flint, I felt that it was very important to share Dr. Vereen's experience with you. Because again, often, and I'll speak for myself and some of the folks that I co-labor with, we feel hopeless. We're still in the midst of a water crisis, toppled with COVID-19, toppled by racism as a public health crisis. And so we have this type of expertise, and I'm privileged to work with Dr. Vereen and others such as our panelists. But I wanted to share his experience with you all so that you know that we're not forgotten. And there are people in the streets making a difference to make sure that we can address these these issues. Don, I had a couple of key points, and then some of the questions are rolling in, so I'm not going to take too much time. You did mention something that I kind of like perked up a little bit about women being more intelligent. Did I hear that correctly?
Yes, I think I have been, I am quoted in testimony in Congress. I have certainly said that in other less formal settings. The reason I'm saying that, I'm saying it mainly because I do believe it to be true. And it is a little provocative, but if women can handle their emotions, even if you're not in total control of them, and often we're not in control of our emotions, if you're able to sit with them, you know, the fact that I've seen women, and I understand this, but in seeing people in my office in a therapy, and they're overwhelmed with feeling, they sit there, and often they can't say much, but they're able to use words to identify what they're experiencing.
Mhm.
The men find it difficult to sit there. They leave the room. They do something. They almost always do something. That's a brain activity. The brain is wired that says, I can't stand this, and they leave. Now, I'm not saying they're weak. I'm just saying there's a different way of dealing with it. And the fact that your brain can allow you to sit and use words or attempt to use words means that you've got an extra capacity that men don't. Now, women will get up and leave the room if they're about to hit you. Okay? And that's smart because it says, if I stay here, I'm going to hit you. I'm gonna do something. It's probably justified, but it's something that's there. And again, that's thinking. It's deliberate, and it is an important difference between men and women. Now, I'm not saying women are better than men. Okay,
Mhm.
for all I know, evolutionarily, maybe it's a good thing that men can't pay much attention to their feelings, because maybe it's easier for them to be a soldier, not think about what's going on, take orders, and put themselves in harm's way in a different way.
Mhm.
If you're a woman and you have kids, or you're about to have kids, or you're thinking about having kids, you've got to protect your body in a very different way, because that child, that God-given living being, can't come into the world without the woman being healthy.
Mhm.
And so there's a selfishness that men love to push on women. It's like, well, you know, being selfish is a good thing. You have to take care of yourself first. They tell you on the airplane, you put your mask on first, then you can help other people. So there are these differences, and I say it's smarter. There's a judgment, you know, kind of baked in there. But I'm not saying one sex is better than the other. I can tell you in therapy goes a lot further with women, because they can sit with those feelings. With men, the approach has to be different. I wish the standard wasn't, oh, you come into a room, you close the door, and you can only sit and talk. Because I think for men, it might be better if you could go walk around, go to a bar, have a glass of wine or two, or a beer or something, to loosen the men up, and you'd get more. We've stretched the rules a little bit to try to get more at men, but men can be very trusting. Ask their women or their partners.
Mhm.
The partners will tell them, yeah, they can trust. But there's a lot of mistrust out there.
Mhm.
Everybody's mistrusting. And for us, it's especially tough because we've not been able to trust for centuries. We have to be careful who we trust.
Don, you mentioned significant others, and
Yes.
I cannot have this conversation with acknowledging Dr. Susan, your phenomenal wife, the previous provost of University of Michigan, and who made you a father for Father's Day. Um, just thinking about the balance between, and I love the point where you say that, you know, health, men's health and women's health are very parallel, and just a couple of things that are different between the two sexes.
Mhm.
um, we have a boatload of questions, so I'm gonna bring the panel all back in. And as they're coming in, if you could think about the question, when folks are looking for a PCP, what are some of the questions they should ask when trying to decide what that PCP would look for, which PCP to select, and also, um, you know, um, thinking about an African American PCP, the shortage of folks that look like us, taking our care into consideration. Don, did you have any comments or questions we could ask about?
Were you hearing that feedback?
Yep.
Okay. Yeah, I see that I keep moving in and out. I'm not sure what's going on. There are a couple of questions, and this would be good for everyone to ask, not just men. Um, the issue is the critical issue is trust and getting to know the practitioner. A reality is many practitioners literally have minutes. They just have a few minutes to be with you. That's men or women. And um, I would ask a general question, like, because this is what I have my mother ask her physicians. Are you going to take care of me? Now that seems like a general question. It's like, oh, that's not specific enough. That's precisely the kind of question you need to ask these doctors, because that's what we need. We don't want somebody who is just going to be a test decider and a test scheduler. How are you going to take care of me? Now, I asked the question that question of the doc that I had when I moved here. And he was totally cool he was very direct, and he answered very quickly. And he says, well, look, you are a young 50-plus-year-old Black male. There are certain things that go along with your age group. I'm going to zero in on those kinds of health issues that we need to look for based on knowledge that we already know. And then once those are done, whatever else comes up, I'm going to pay attention to those. So at the end of our 17-minute session, he says, your blood pressure is up a little bit. I've checked your whole body. Even though you're a Black male, you can still get melanoma. When I look at the numbers, skin cancers, lung cancers are big issues that we need to, pay attention to. And after he went through his list, he said, yep, your blood pressure is probably the thing I'm most concerned about. You need a colonoscopy, and you need a couple of other things. And that all satisfied, for me, an answer to how are you going to take care of me? Because what he did also was to say he saw me. He saw who I was. He wasn't afraid to say, oh, well, you're a this age Black male. That's fact. That's okay. He was white and Jewish, but he stated a fact. and he was going to look after me. And if there were things that put me in a category, even though they're just statistics, you go for the obvious. He unfortunately passed away he was killed in a car accident, but that's what he did. That's how he tailored things to me. He also took into account that I'm a doc, and I could talk to him about things like that. But here, let me also share something, because we're focused on men's health. I was telling him about some issues that I was having urinating that I had actually had for a couple of years. I'd mentioned to my previous doc, and they said, your PSA is fine. We did a digital a rectal exam to check your prostate. Didn't see anything, nothing there. Well, I was having some symptoms. And sometimes I would have these, and I was having experiences where it was tough to tell which way I needed to go to the bathroom. And I told him. He examined me again. He took another PSA. Didn't find anything. Well, 2 or 3 years later, shortly after that, I did have the colonoscopy, and I have ulcerative colitis. And the ulceration happened to be right over where the prostate is. So it turns out I also had prostatic hypertrophy, but it was only the middle lobe. It wasn't the lobes on the side that most men get. And it explained to a T, but it took a female doc with much longer fingers to make that diagnosis. But, he listened and responded, and I got trapped in a sense because I knew what I was experiencing. And I know how men and women feel. They go to the doc and the doc's not listening to them. But here was a case where, that's why you do the tests, but sometimes the doc is doing the best they can, and they have to hurt you to figure out what's going on. So you want to trust somebody like that. That's hard. But, I've been in a tough situation, actually several, but I've been in a tough situation, and fortunately I had a good enough relationship with him that part of the answer was answered because he picked the right thing. You're not only the right age group, but the GI issues you've been having for decades, we need to rule this out. And so as a doc, I've been there.
Gotcha. Next question is a doozy. I'm going to add it to the screen. What are the signs and symptoms of low? Oh, can you guys see that?
Yes.
Okay. And I'm going to add Nurse T back in. Does anyone want to address this question? Questions? And thank you, Ms. Wright, for dropping it in the chat. What are some symptoms and signs of low testosterone levels in men besides sexual dysfunction? Should men get routine level checks for physicals? And I noticed a lot of men do not get tested, but often need treatment once tested. Also, is there a holistic way to raise testosterone levels? I can answer one. Not being a medical professional, but hearing the conversation. The second question is, should men get routine level checks? And Don, is that a yes?
I would say only if there are symptoms. So to go back to the first question, think about what testosterone does. Testosterone is a hormone that operates specifically in the testicles. And so if there's a libido change, usually in the lower direction, And testosterone is a form of a steroid, which is important in the development of muscles. And so muscle mass in men does decline over time. Men will develop a belly. I blame mine on COVID, but my muscle mass is declining. My metabolism is going down because with lower testosterone, my metabolism is not as fast as it would be. And I have to work harder to keep my muscles in tone because testosterone is related, it turns into the steroids that are used to make muscle mass. Lower testosterone also has an effect on your mood. So you can have depressive symptoms. So again, think about what testosterone does in the body. Those will be the symptoms. If you've got them, if you're seeing your doctor regularly, that would be part of a screening, or it's a chance to bring them up. If you're not seeing a doctor regularly, if you don't have those symptoms, I would say it's less important that you have to have a test. Because if you find that it's low, well, how am I going to know that it's come back up if you're not experiencing any symptoms? And that reminds me that these test levels are an average. There are some people, they need to be at the upper end to feel normal. And then there are others that may be well below the threshold and look and feel and act perfectly fine. So I would focus it based on the symptoms. But you got to have a good doc who's going to ask the questions, and then the patient has to be honest and not fib, not fudge. Hey, what is your sex drive like? Have you had some issues with performance? Can you maintain your erections, for example? And you just have to ask the questions and hopefully get an honest answer. These are not things to be ashamed of. And perhaps we should be teaching young men what happens with age. When you're 12 and 13 and you're getting sex education in school, what happens in your 20s and 30s and 40s? What happens in your 40s, 50s, and 60s? So that it's not a new phenomenon when you reach 40 or 50 or 60. This is life. That's normal. And there are things that you can do to help keep things, going as strongly as possible for as long as possible.
Thank you, Don. And Nurse T, did you have a input for the last question about holistic ways?
So 8 evidence practice ways to increase testosterone levels naturally: exercise and lift weights, eat protein, carbs, minimize stress, cortisol levels, sun. So get plenty of sun or vitamin D. Make sure you're taking your vitamins and your minerals. And one huge one is plenty of rest.
Thank you. Anyone else want to chime in on this question? Again, Ms. Wright, thank you. That's an excellent question. All right, next question. Ms. Prince, if you could bring the slide up to number 11. We asked the question earlier was about boosters. And also, how did you get COVID if you were boosted? And then what is the boosting schedule?
Okay. How COVID?
Next slide, please. Thank you.
Okay. Is that for me? Or how did I get COVID if I was boosted? During the time I was scheduled for my 4th booster within that 4-month period. As they say, the antibodies or natural immunity starts to wane or decrease after you have had COVID, which is natural immunity, or actually had the vaccine. So that's why they recommend to receive a booster to increase your antibodies to fight COVID-19. Now, I did have it. I was not severely ill. I was not hospitalized. I was able to not go in the hospital or be put on a ventilator. And I did receive my fourth booster after that. So I do believe that me being vaccinated also helped decrease my risk of being hospitalized, placed on a ventilator, or death because of some of the risk factors that I have. Currently, the booster schedules we are boosting for Pfizer only, 5 and up. So 5 and up is eligible for a booster. The schedule for a booster is after you completed your Pfizer 21 day, your completed series, you're eligible for a booster 5 months for your first booster. And then you're eligible again for if you're immunocompromised, it's 28 days after your completed series. Okay, and for 50 and up, we've had back in July, people have their one booster. So 50 years and older are eligible to 4 months after their first booster. You're eligible to receive your second booster for Moderna, Pfizer, and J&J.
Thank you so much. We also added additional clinics. We wanted to make those available to you visually. So some additional vaccine clinics can be found this Monday, which is tomorrow, at the Flint Safe Summer Kickoff and Community Resource from 4 to 7 at Memorial Park Playground, which is on Court Street. Again, that's tomorrow from 4 to 7. Tuesday, we have Feed the City. That is taking place from 12 to 3 at Center of Hope. You can also get your vaccine there. And then a couple last ones. The Ice Cream Social is this Friday, the 17th from 1 to 3. And we have 2 more, Friday and Saturday for the Flint Juneteenth Black Wall Street, and then next Saturday at Flint Pride Parade. And those will be on the slides, and we'll share those out as well. We're 3 minutes until the session closes. As you can see, I really felt it that we needed to expand from our just 1 hour because it's so important for our men to be strong and healthy and vulnerable. Thank you so much, Dr. Vereen, for your expertise, for taking time out to share this information with us. As always, we have a phenomenal team from Michigan United, Dr. LaTresca Gordon, Nurse Tanya Battle, and Nurse Tarnisha Martin, Nurse T. Thank you so much. A couple of other community events throughout the week, actually started yesterday. The traditional Flint Juneteenth presents this slew of opportunities to gather to celebrate our culture. And again, that information will be shared through our Instagram and our Facebook page. The next slide are the opportunities for you to engage. If you want to be a part of the parade for the Juneteenth next Sunday, the 19th, that the registration link is there. You can reach Mr. Dewan Robinson or Mr. Reggie Davison. And also, if you're a vendor and want to have a table at one of the events, there is a link where you can register your organization to be able to sell your products and service. We want to support one another. Next slide, please. Again, the vendor registration. There's 3 different days where that'll be available for everyone. And then lastly, in our last minute, we are contributing one of Flint's own great Dr. Ehil Deloney for receiving her being honored as a 2021 recipient for Doctors of Human Letters from the University of Michigan. It will be during the Flint Juneteenth Freedom Fund Youth Dinner from 6 to 9. We'll also be airing it via Zoom and a Facebook Live. So please do register for that event. And then lastly, if you found any value in this information, please share this completed podcast with your networks, and then join us back here We'll probably have another surprise guest. I don't know if we can top Don, but we'll do our best to continue to bring these excellent resources. We'll be back here June 26th from 3:30 to 4:30 for our fourth episode of Taking It to the Streets, Healthy Conversations for Us, by Us, COVID-19 and beyond. Thank you so much, everyone. Have a blessed evening, and we'll see you here in 2 weeks. Thank you, Don.